Good afternoon, Madam President.
Good afternoon.
Madam President, this is, as I understand it, the fifth contract we're going to have in front of this chamber here today so far with respect to contracts that our body has to vote on yes or no. And I would note that earlier on, the first contract had a wide percentage difference, and as each contract came down the pike, the narrowness of the vote got closer and closer. And while I understand that in 2019 there's only a $90,000 increase in the budget, when you add all the contracts together, if you include this contract, we have added to our budget roughly $12 million. So in a budget that we have a deficit, we have added $12 million that we have to work out over the next 2 years. People may say, you know what, that's really not a lot of money. Out of a $17 billion budget, it's nothing. Well, out of a $17 billion budget, $50 million is not a lot of money. But what could we do with that $13 million, that $12 million? What could we do? So I looked and said, what do we have as deficiencies in the governor's budget where he had to make some calls, and how we may want to use that money differently. Our Connecticut community colleges have a $9 million hit. Well, $12 million would pay for that. Our mental health. We just had some press conferences in this building about mental health. That was cut $4 million. Well, maybe we could use this money for our mental health. Care for Kids. Every year we do something good for Care for Kids, which is a program I believe wholeheartedly in. And fought hard in our bipartisan budget to make sure we do it so that people can go to work and their kids can be taken care of. We wouldn't be able to continue our pledge of adding money for Care for Kids. We're talking at a time that this contract before us adds a 3.5% COLA increase each and every year. But yet, in the governor's budget, we are removing the cost of living increase for the blind. We're moving the cost of living increase for the disabled. We're removing the cost of living increase for TANF in lieu of a new contract that we could reject. We talked about, just the other day, we heard about the nursing homes, and they're going to go on strike. If we did a 1% increase in our nursing home, that would cost us under $12 million, $11.8. Wouldn't it make more sense to put money in those programs I just talked about? Wouldn't it make more sense, rather than adding to folks who are well paid in this building, plus the fringe benefit at 96 cents for every dollar that we pay for salaries, 96 cents is fringe benefits. Wouldn't it make sense that we say what we said as a bipartisan group for the last 2 years? We can't afford what we can't afford. We didn't give these folks raises, I admit to it. Not in the bipartisan budget, not in the partisan budgets. Because we couldn't afford it. Because we want to fund TANF. We want to fund mental health. We want to give raises to those nursing homes. Budgets are choices. And be clear, you are making a choice if you vote yes or no today. What is more important? Folks that are making $100,000, $100,000, $80,000 pure salary, not the benefits? To give them a 7% increase plus 3.5% increase? Or folks who are making $25,000, $40,000 and saying, we want to help you. You need a help up in today's economy. You need the help up in social services. That's the choice. Let me add to this. If you vote yes, you have taken on two obligations. First obligation, by voting yes, you own this contract. Second obligation, in less than 1 month, in 3 weeks, a budget out of Appropriates and out of Finance has to come out of both committees. And many of you on both sides of the aisle sit on that Appropriates and Finance. You have an obligation when you hit a green button that you're saying, not only do I think this contract is right for maybe policy reasons, but I think it's right for money reasons. And when I vote yes, I know in appropriations or in finance, both committees are going to come out with a balanced budget. Both committees are going to come out and say, we are going to make this obligation that we're signing on to today by hitting the green button, and we are going to balance a budget. Because if you vote yes, and you're unable to balance the budget, somebody is going to get hurt. It's not going to be these contracts because they're done. You have said a whole bunch of messages. I'm either going to make the cuts to do it, that I didn't do it in committee. It's your obligation to do it in committee. Or I'm going to raise taxes. Then you better do that in finance. But don't come out of those committees with an unbalanced budget. Don't come out of those committees with an unbalanced budget if you're going to make a promise when you hit that green button that I'm going to pay for these contracts. Then you have an obligation to say how you're going to pay for these contracts and balance the budgets. That is your obligation. So when you hit the green, you have to be willing to say, I'm going to make the hard decisions to make sure these budgets balance. We are denying people that we have made promises to every year. Every time we increase a cost, a fixed cost, we deduct our discretionary funding. How many of us have stood in front of IDD, the adult disabled families, and said, we'll get you off the waiting list? We promise we're going to move you off the waiting list. This is $12 million further from moving those people off that waiting list. That's what it's about. It's easy to say yes. It's tough to say no. But when you say no for the right reasons, people get it. They understand. Because there's people who need more help than others. And I mentioned who those people were. Madam President, I'll be voting no on this contract. Thank you.
Senator